I don't know if it's helpful. I've been a GP for nearly 20 years, and to just describe some of my experiences since what happened to me in looking after particularly men with mental health problems. And I sort of try to jot down a few thoughts about what I've noticed. And I think one of the things is that often, particularly young men, can't really understand what's happening to them and why, why the usual active selves, they're not the same person. They're not wanting to do the stuff that they normally do, and they're not wanting to see the people they normally see, and just be out there, like lads do, just get out and about and stuff. And they don't often a bit similar. They don't often discuss them. They don't feel able to. They don't discuss. They make excuses for not going out. And don't discuss with friends and family about why they're not like that, and probably just go to bed and stuff, and don't kind of talk enough. And I think that's one of the problems that then leads to particularly young men not finding help earlier on when they get ill with depression, because it's that sort of male sort of stereotype, isn't it? That you're strong, if you're in a relationship, you're a breadwinner, you're resilient. Stuff goes wrong, you can sort it out. You can look after yourself. I can look after myself, and it's that sort of stuff. And then all of a sudden you're feeling like you might not be able to look after yourself, and so you feel almost kind of weakened in who you are. And I think that's sometimes why you start to lose the sort of your self-esteem, and then normally things are, it's like water off a duck's back and stuff. But then sometimes, particularly young men that come and see me, they get irritable and angry with people, and they're not always been like that. They've usually been all right, but they're feeling that slightly paranoid feelings that everybody's after them, and with some world's sort of against them and stuff, and they get angry. And I think it's when they start to feel helpless because they've lost control. They don't feel like they've got all the control that they want, and they don't feel like they're able to do the things that they want to for their girlfriend or their wife or their mums and dads and stuff. Or often they can't. Maybe they've got stuff. They're trained to do stuff in jobs, and they can't get the jobs to do the jobs to do. So they feel like they're not worth anything to people. And it's really, really difficult for a lot of young men. When they're in that position, they've got that stereotype of what they should be like, and they don't know that there's help there, and that if they do go and find some help, they can get better. You can't sort out the problems that have made them feel like that, but they can feel better with those problems often. And sometimes when you do feel better, you're better able to sort out the problems that are going on anyway. So that's my experience, really, that it tends to be often much more than people realise in late teenagers, 20-year-olds. Often going through college or courses, sometimes not sure why they're on those courses completely, because that's where everybody went, and sometimes not able to find jobs. Often starting their family, just as like in a sense what happened to me a bit older. But there is help for them, and I think it's often just recognising that help is there. So it's about actually going to find help, and there's different places that you can get help from. And of course, one of the places is your GP. And so I suppose there's 5 ways that a GP can help a young man with these things. First of all, just to listen to what's happened. Once you've gone in to see a GP and the door's closed, it's just the two of you. No one else is going to hear. It's completely confidential. They'll listen to what's happened, and just for the first time, just to tell somebody what's happened and how it's feeling. And then the second thing the GP can sort of help hopefully do is explain why what's happened has made you feel like that, and try and make you feel more normal. Because you often feel, like I said, you often feel it's your fault, but it's not. And just try and explain why those things make you feel like that. And then maybe also explain what depression is and how long it takes to get better. That you don't get better quickly, but that it's fine, and that that there are many people that are depressed, and you can, as you're getting better, you can carry on, you can live an okay life, and there's no shame in it. And then of course, suggest how to get better. And one of the things I think is that we know now probably the best way of getting better is actually going and talking to somebody. But I think the evidence shows that particularly young men find it far harder to go and talk to somebody, and I think they're sort of much less likely than women are to be able to do that. And that's fine, and that is fine. But I think once you've gone to see the GP and you've opened up, you often feel that it's easy. Well, you've opened up once, and you sometimes worry that you've got to open up to somebody else. But actually, I think once you've told somebody, and then you may need to go and tell somebody else, but not always. If people can feel a bit that's a good thing, and that's the way of getting better. The other thing, of course, treatment is medication. But often that doesn't work as well as people think it does. And actually, you think, well, if I'm ill, I'll go and see the doctor and they'll give me some medication, I'll get better. But in fact, that's not how it works often. You need to sort of work out yourself how to get better and become self-reliant again and things. But medication has a place. And of course, the 5th way that a GP can help is to give you some support, because if they know what's happened whilst you're getting better. And often some of the blokes that I look after, I might not see them very often, but they'll still make an appointment a few months down the line, and maybe just want to tell me how they're getting on. Maybe they're having a bit of a wobble and they just want to check they're not getting ill again. And I think having just somebody that just one person that knows kind of all of it, and you can just go and touch base with them and say, yeah, I think I'm all right, but this has happened, that's happened. Yeah, okay, yeah. And I think that's a really important bit that GPs can do as people start to get better. And sometimes when people recognise that it's coming back, the GP will remember, or at least it'll be in the records, remembers, oh, this is how you felt before. So I just encourage people to go and see their GPs, but also to remember that almost everywhere now, there's actually places, often they're called talking shops or things. There's actually places as young people that you can almost just go and get some help anyway, because it doesn't have to be a doctor. It doesn't have to be a doctor at all. So often if you're in a college, there's somebody you can go and talk to. If you're in a workplace, there might be someone you can go and talk to if it's a big workplace. So not to just think, oh, I'll go and see the GP. We're there to help anybody who needs help. But also there's other things that might work better for certain people, and that's absolutely fine. It's making that first step and saying, I'm not myself. I don't understand why. And I want to get back to myself. It's often once you make that first step, that's almost the first step towards getting better in itself.